Hey guys, welcome back to the channel. I'm still doing background videos about where I'm at and how I got to where I'm at right now. My last video I ended up talking about my second surgery, or my first surgery. So this one is going to be about my second surgery. Dr. Gentry in Amarillo did my first surgery. My second surgery is being done by Dr. Lega in UT Southwestern. So UT Southwestern, we go down there April the 10th. My surgery's scheduled for April the 12th, but we go down there April the 10th because I have to do, pre-surgery labs and pre-surgery stuff. So we go down there on a Sunday, and on Monday I go in and do another MRI so they can pinpoint exactly where my tumor is going to be, and they're also going to do in-house monitoring while I'm asleep. We discussed doing an open, awake procedure on me so that they can monitor my movements and stuff, but Dr. Lega felt after looking at my MRI that was not necessary, mainly because of where it's at. It's not going to make that big a difference of just doing neural monitoring with me asleep or awake. It doesn't matter either way. So we're not going to do it, didn't do it awake. We did it with me asleep, which I was thankful for, because I've done those awake procedures. They don't look like fun for the patient. So anyway, I go in, have my procedure done on April the 12th in Dallas at UT Southwestern, the Clements Hospital. He does a debulking. He was hoping to get 60 to 70%. The goal is to get at least 80% of the tumor. That's the goal. But he was worried he'd only get like 60, 70% because of where it was at. And after we got done, had an MRI done the next day. And the MRI showed that he got 85 to 90% of the tumor, which is almost unheard of, especially where my tumor was at. So luckily we got a lot more than what he was anticipating to get. So we got a good result on the tumor debulking. That was a big positive as far as that's concerned. They kept me in the hospital another day, let me go home. I had my surgery on a Tuesday and I was home by Friday, which was really nice because they let me out of the hospital on a Thursday. We drove back home on Friday. So I was not in the hospital very long down there. I recovered very, very quickly from both surgeries. But I think in hindsight now, and looking back, and I'll talk about this later, I think that was probably a mistake. We didn't give myself enough time to heal. So I had issues later on. But as of right this moment in this timeline, I was doing very, very well. And come to find out, my steroids were helping more than anything. I'm an older guy. I mean, I'm in my 50s, but I had a rough teenage and early 20s, did a lot of stupid shit, abused my body pretty significantly as far as physically. So I got a lot of aches and pains and stuff like most people in their 50s do. And when I got on steroids for my swelling and stuff, that steroid stuff took all of my pain, my aches and pains that I had, took it all away. So I had no idea I was hurting as bad as I was on a daily basis until I was on steroids and was no longer hurting anymore. It's kind of interesting in and of itself. So I think one of the reasons I recovered so fast is because I didn't realize how much pain I was in before I had my surgeries. And so after surgery, I didn't really feel the pain because I was so used to having so much pain in my body all the time. So it's kind of an interesting conundrum. I healed faster because I wasn't hurting, but I wasn't hurting because I was on high-dose steroids, which at the moment I'm at right now, at this very moment in my life, I'm trying to come off the steroids again, and it's very obvious that that was the case. The steroids were helping more than anything. So I'll talk about that more in another video also. But got done with the second surgery, got home, started doing my own rehab. I did my own physical therapy, that kind of thing, here at the house. Because I'm a stubborn ass, and that has a lot to do with why I recovered so fast too, because I'm stubborn, and probably did a lot of things I shouldn't have, but that's what it is when you're stubborn. However, I recovered from my second surgery, and we started doing chemo and radiation 6 weeks after surgery because they wanted me to heal my my incisions and stuff before they started radiation. So we started radiation and chemo, which was a 6-week course, and that was rough in and of itself. I mean, it wasn't horrible because the chemo was, I mean, it made me nauseous, but the nausea drugs actually helped more than anything. But it wasn't like my hair didn't fall out, you know, it wasn't like I was incapacitated because of the chemo. It sucked and it made me sick, but it wasn't horrible. And the radiation was not pleasant either. It just made me really, really tired. So every day after radiation, I would have to lay down and take a nap. But overall, it wasn't as bad as I anticipated, which was nice. So long and the short of it, we go through radiation and chemo, and of course, you have to do follow-up scans. So every 2 to 3 months, we get a follow-up scan when you have a GBM because we want to see if it's growing more, if it's recurred, that kind of thing. So after we do the radiation, we wait till the radiation's done and the chemo, and then we do a post-radiation scan to see what kind of progress we made with the radiation and the chemo, if any, and to see if we have any regrowth. So at 6 weeks, well, after I got done with radiation and such, we waited a couple of weeks, and then we did another MRI to see what's going on. Got the results of the MRI back, and we had it looked really bad. We'd had a regrowth of the tumor, and I was starting to have symptoms again, which means that it was affecting the area that was right next to my motor cortex. So we consulted with Dr. Lega again after we got the MRI. He looked at it, and he wanted to do a third surgery. But this third surgery, he did not want to do an open procedure like we've done in the past too. He wanted to do what's called a LITT procedure, which is a laser interstitial thermal treatment. It's a LITT, and it's a minimally invasive laser procedure that's guided by an intraoperative MRI. And it's a really neat procedure, technological wise. We can't do those here in Amarillo because we don't have the technology here, because you have to have a special operating room built with an MRI inside the operating room. You have to have special equipment, special instruments, all kinds of stuff. I mean, it's literally millions of dollars to set up one of those programs. UT Southwestern is one of the only places that does it. There's a few other places, Dallas Fort Worth area does it, and of course Houston does it, and other large teaching facilities do it. But it basically has to be a large teaching facility. And Dr. Lega has done hundreds of these procedures on his patients, and they're actually really good because it's not impactful as far as doing a big open craniotomy anymore, and he can pinpoint exactly with the laser where he wants to go on the MRI. So it's a lot safer procedure as far as not paralyzing me and preserving the motor movements and such, because he can pinpoint exactly with the MRI. Now, the bad part about this is when we went to go get it approved for insurance denied it as not medically necessary. So I had a whole fight with my insurance company. I wound up having to pay for this procedure out of my pocket, which unfortunately we still owe about $35,000 on this procedure. So insurance company denied it completely. They're still denying it. We're still trying to fight with them and trying to get them to pay for it. But right now we still owe 35 grand on hospital bills. We already dished out about 60 grand in hospital bills this past year, and we still owe 35 grand. So if you, this is a plug, but I'm sorry, but I don't like asking people for help, but we do have a GoFundMe and a Venmo up in my bio, and I'll put a link in on my YouTube description down here. If you want to help us out with our medical bills, those are available for us. Like I said, we still owe $35,000. We've already paid out about 60 grand. So, I mean, it's horrible. And that is with good insurance, by the way. And we've owed almost $100,000 in the last year. and that's with insurance paying the majority of what we've had done. The only thing they really didn't pay for were my out-of-pocket expenses, my deductibles, obviously, and this last procedure, which we had to pay for out of pocket. Once again, I'll do a whole other deal about insurance and all that kind of deal, a whole other video on insurance. But as of right now, that's where we're at. So on the third procedure, I had to pay for it out of pocket. And my next video is going to talk about that third procedure, because that third procedure was actually really kind of cool. And that'll lead up to where we are right now.